All right, we're doing, looks like be chapter 6, bones and skeletal tissue. All right, so I start off with cartilage. And bone, just like cartilage, it's a connective tissue, but you want to take a note that cartilage is avascular. There's no blood vessels going through the cartilage. So that means they're getting their oxygen and nutrients, those cells of cartilage, from surrounding tissues where the blood vessels are located. So there's an outer connective tissue referred to as the perichondrium surrounding the cartilage, and through diffusion, it's going to provide oxygen nutrients to cartilage. But since cartilage is avascular, should you damage it as an adult, it's not likely to regenerate. Cartilage, well, there's three major types of cartilage in the body. The most abundant one is called hyaline cartilage. It's a little bit rigid, yet somewhat flexible. So it's found in areas so to give shape to an organ. Elastic cartilage is the least abundant type. It's the most pliable, has elastic fibers. You're only going to find it in two areas. One is in the ear, and the other is a structure called the epiglottis. The epiglottis is what prevents solids, liquids going down your trachea when you swallow. And the third type of connective tissue is called fibrocartilage. Fibrocartilage you're going to find in areas to absorb compression. So you find it in between your vertebrae, making up what's called intervertebral disc. You find the padding in the knee of fibrocartilage called the meniscus. And you also find fibrocartilage in front of the pelvic region. There's a padding called the pubic symphysis. So notice in fibrocartilage, you got collagen fibers kind of stacked together to absorb compression. Okay, looking at this picture here, you're looking at the bones of the skeletal system. There's 206 bones total, and the bones in brown are referred to as axial skeletal system. So those bones consist of like the skull, your vertebrae, and your rib cage. The other bones that go under what's referred to as appendicular skeletal system. Those include like the ones you find in your appendages. In other words, making up your arms, your legs, your pelvic region, and also your scapula and clavicles. And then the bottom right of this picture is showing us the three types of cartilage. In blue, again, is the most abundant type. It's referred to as hyaline cartilage. You find it like lining the sternum to your ribs. You find it at the end of your lung bones and tip of the nose as well. The least abundant cartilage here in this green coloration, you find it in the ear and also the structure above the trachea called the epiglottis that prevents solids and liquids going down your trachea. And then color-coded here in red is referred to as fibrocartilage. You're going to find fibrocartilage making up the padding in the knee to absorb compression. In front of your pelvic region, there's also a padding of fibrocartilage referred to as the pubic symphysis. And then in between your vertebrae to absorb compression, you have these discs made up of fibrocartilage referred to as intervertebral disc. Oh, I forgot to mention, as far as hyaline cartilage, you also find it within your trachea, helps keep the airway open. Now, anytime you grow in length, it's referred to as interstitial growth. If you're growing in density or diameter wise, it's referred to as appositional growth. So when bone or cartilage, when you start growing in density, the cells that make up the matrix, the medium of the tissue, for cartilage, they're called chondrocytes. And once they get trapped within the cartilage, they're mature cells, and the space they're trapped in is called a lacuna. As we get older, the cartilage, let's say lining the sternum to your rib cage, tends to get harder. It's not as pliable as when we're younger. So when they refer to calcification, they're referring to it getting harder as we age. And again, as far as the skeletal system, those bones that you find in the skull, the ones that make up your vertebrae, your rib cage, they go under what's referred to as the axial skeletal system. And the ones you find in your appendages pretty much are referred to it as appendicular. Bones by shape can be named. So if a bone's longer than it is wider, well, it's a long bone. So an example like the ones in the arm, your top upper arms called the humerus, the ones in the forearm, the radius, the ulna, even the ones in your fingers, the phalanges, they're examples of long bones. Femur, the upper part of the leg, fibula, tibia, the lower part of the leg. They're all examples of long bones. Short bones, well, kind of just how they sound. They're kind of small. They're not as very long as they are wider. So for short bones, you find the ones in your wrists. In general, they're called carpals. The ones here in the ankle, tarsals, are examples of short bones. Even your patella, the one you know as your knee bone, is a example of a type of short bone. Now, just to go over tendons and ligaments, tendon, ligaments, connective tissue, are dense, regular connective tissue. So tendon is connective tissue connecting a muscle to bone, whereas a ligament, it would be connecting a bone to bone. Flat bones, typically with flat bones, they don't have a cavity within them. However, compared to a long bone, if you cut into a long bone, there's a cavity within the long bone. So flat bones, just kind of like they sound, they're flat. They don't have a cavity between the sides of the bone. So going in a picture here, example of flat bones could be like the ones making up your cranial cavity, up top, frontal bone, temporal bone to the side, occipital bone to the back. Those are example of flat bones. Now, some bones may not fit any of those descriptions as far as shape. They look kind of irregular in shape. Therefore, that's how they're named by shape, irregular. So examples of regular bones could be like your cheekbone, which is your zygomatic bone. The upper part of the skull here, your teeth here, that bone there area is called maxilla. You can refer to it as irregular. Your mandible, regular bone as well. Your pelvic region, the coxal bones are irregular bones. So that's one way you can name bones is by their shape. Long bone, short bone, flat, or irregular. So again, picture here emphasizing the shape. If it's longer than it is wider, it's a long bone. Typically, when you cut into a long bone inside, you'll find a cavity. Flat bone, just like they sound, they look flat. There's no cavity within the bone. Example, your sternum is an example of a flat bone. Short bones, typically most are small, like in the ankle. It's a short bone. Your wrist, those are short bones. And then again, if the bone doesn't fit any of those shapes, it looks irregular in shape. Well, that's how it's named, irregular bone. And so in this example, when you pull out a vertebrae, it's an example of a regular bone by shape. The function is your skeletal system. Okay, well, yeah, it does give support. Protects organs. So like your cranial cavity, there's the brain within it. So it helps protect it. Your rib cage gives protection to the organs within your rib cage. And your vertebrae protects your spinal cord. Bones themselves aren't directly involved in movement, but since they provide attachment sites for skeletal muscle, which is the only muscle you can voluntarily control, they indirectly are involved in movement. So that's what they're referring to here as movement. In your bone, you can also store minerals like calcium and phosphorus as a reserve, where should the levels in your bloodstream fall below normal, you can pull some out from your skeletal system. And inside the bone, where there's a cavity, there's bone marrow, and that's where you're going to form blood cells, red blood cells, white blood cells, and fragments of stem cells called platelets that are necessary to form a blood clot should you be bleeding. So forming blood cells, the general term is hematopoiesis. And the bone marrow, when we're young, is nice and red. And as you get older, you tend to store lipids in there as well. So it may look yellow in color. So that's all it's saying. As you get older, you can also store lipids in your bone cavities. Now, learning the bone names is not that challenging, um, especially since you have more than one of certain bones. Um, what's challenging is these landmarks, learning the names of landmarks on the bone. Similar to if you think of a mountain has a name, but on the mountain are different landmarks, which have more specific names. So these landmarks could be maybe a bulge, a depression, or a hole within the bone. And these landmarks may be attachment sites for a muscle. So maybe that's an attachment where a tendon would be, or maybe an attachment site for a ligament connecting a bone to bone. The other thing is some of the landmarks, maybe areas where two bones meet, and get used to the word joint. Joint means where two bones meet. So where two bones meet, they may take on a particular shape or landmark that may have a specific name as well. The other thing is if it's a hole, maybe a nerve's going through the hole or some blood vessels. So those would also have certain specific names, are also considered landmarks. So these are all the different landmarks, which you may find similar landmarks, but on different bones. So like a tuberosity is a rounded projection on a bone, whereas a crest is more of like a narrow region of a bone. Trochanter, the only trochanter is located on the femur. So it's a large, irregular, not so sharp, blunt surface. Some bones may look nice and narrow like a line. Some may have a small rounded little projection on the bone called a tubercle. Uh, an epicondyle, epi means upon, so it's right above a condyle. Condyles are usually round, where another bone is going to be another bone. Some bones, like in the vertebrae, in some areas there, will have a process, an extension. In other words, a process is an extension of the bone. And then if it's nice and narrow, would look like sharp. So they refer to that as a spine. All right, so let's give you some examples here. So like a tuberosity, a large rounded projection. So if we look in here, where do we have a tuberosity? So let's just look at this whole bone. This is called your coxal bone, or you could say os coxae. Well, that's the correct word. You can also say hip bone. But on the coxal bone are landmarks. So to give you an example, here is a tuberosity. It has a specific name called ischial tuberosity. Why is it ischial? Well, when you're developing as a fetus, there's three bones that fuse into one coxal bone. So one is called ischial, the one in front is called pubis, and then the one up top's ilium. So all together they fuse into one coxal bone. And this tuberosity was where the ischial part was, so it's called ischial tuberosity. Crest is a kind of like a narrow ridge of a bone. So up here on the coxal bone is a narrow ridge of this whole bone. It's called the iliac crest. And because that part of the bone was once ilium as you were developing as a fetus. So the crest is on the ilium, therefore it's called iliac crest. Tubercle is a small rounded projection. All right. So we're looking for a tubercle somewhere here. And I'm looking, or it says a process. So up here, right above this whole region here where it meets the lower bones, it's called a condyle. And typically condyles are usually round. So this is bone called the femur, and the landmark here is called a condyle. And if you were to turn this around, you'd see the round projection here. And then right above it is an epicondyle. Epi means right upon it. And then within there is a tubercle called adductor tubercle. Spine. Typically a spine, it's a narrow, prominent ridge of a bone, kind of comes to a fine point. So here's the extension of your vertebrae. The whole bone's vertebrae. This extension is called a process, and because it's nice and sharp, it's called spinous process. Some more landmarks. Some bones may have like a region where it looks large and it's round, and it's referred to as a head. And then where it narrows in, connecting to another area, the narrow region is called a neck. Some bones, when they meet, it may be nice and smooth. Therefore, it's called a facet, where it's nice and smooth. And then again, if it's nice and, well, I should say round, if it's rounded projection and it meets another bone, often they're referred to as condyles. Articular means to meet. Ramus, the only example ramus that we need to know is on your mandible. And it kind of looks like an arm-like extension where you got an upper part of the arm and a forearm. So let's look at the examples here. Like, so this is your rib. This portion here is called the head, and then where it narrows will be the neck. And where it's nice and smooth, where it meets the another, let's say your vertebrae, those are facets where it's nice and smooth. This is bone called the mandible, and the ramus. It's kind of like an arm-like projection. Try to imagine this as your upper arm. Here's your forearm. That's the ramus portion of the mandible. Condyles, somewhat round in this case, yet it's going to meet with the upper part of the skull. So that's referred to as a condyle. Some other examples here, like on the mandible, you have what's called a process, an extension here. This will be the mandibular process. Where it curves in here, like a U, that's referred to as a notch. And since it's on the mandible, you refer to it as mandibular notch. Some more landmark names. Meatus is like a canal-like passageway. So like in your ear canal, you got a meatus. A sinus is a cavity within the bone. So the sinuses they're referring to here are within the skull. A fossa is a kind of like a shallow little groove or depression within the bone. And similar to fossa, there's groove, kind of like depression. A fissure is more like a narrow slit-like opening within a bone. And easy one, foramen, just means a hole within a bone. So let's have a look here. So fossa, kind of depression within the bone. I like to think of like a bowl where the bowl curves in, or maybe like a pool, an empty pool where it curves in, similar to inside the skull. It's curving here where you can feel it curve. That's a fossa. A meatus is a canal-like passage. So within the ear canal, there's a meatus. A notch. Typically, a notch takes on a curve. So here you had a notch within the bone here. A groove's like a very shallow depression. So it's within the mandible. It's called the mandibular groove. Sinuses are referred to the cavities within the skull. So here's an example of one of the sinuses within the skull where you actually have a total of 4. And easy are foramens. Foramens are holes within the bone. So to give you an example, this one here is above the orbital cavity. So this one's called supraorbital foramen. The one below it's below the orbital cavity, so it's referred to as infraorbital foramen. And then one on the mandible is called mental foramen. A fissure is a narrow slit-like opening. So if you look within the orbital cavities, you could see these narrow slit-like openings. So within the top one here is called superior orbital fissure, indicating it's above another one. And therefore the one below is referred to as inferior orbital fissure. Now, when you cut into, let's say, a long bone, there's going to be areas of the bone where it looks nice and dense. That's referred to as compact bone. And then when you get into the middle where the cavity of the bone is, there's going to be pockets where you'll see bone missing. It looks just like a sponge. So they refer to that as spongy bone. Bones that are flat, typically they don't have a cavity within the middle. So you're going to see areas where it's just spongy bone, and the areas of the spongy bone that resist stress are referred to as trabeculae. Now, when we get to the picture of the long bone, the extension is called the shaft. And all around the outer rim of the shaft and around the heads of the long bone, it's compact. And inside the long bone is a cavity called medullary cavity, where you got red bone marrow, where blood cells are produced. And again, as we get older, you may store lipids in there. So yellow gives the appearance of the lipid. The head regions, well, they're called epiphyses. So the one that's closer toward the shoulder region is called the proximal epiphysis, and the one further away is going to be referred to as distal epiphysis. When you grow in length, there's an area within the bone called the epiphyseal plate, or you say epiphyseal line. Basically, you have hyaline cartilage there, and the cartilage cells called chondrocytes, they replicate, extending out the length of the bone, which is first cartilage, and then eventually that hyaline cartilage, it dies and gets replaced by bone, and therefore you extend out the length of the bone. And you also help modify the diameter of the bone as well to support the length. At the end of the bone, because there's hyaline cartilage there as well, because it meets another bone, they refer to it as articular cartilage, even though it's hyaline. It's just giving me the location. That means it's going to meet another bone. Articulate means to meet. And where two bones meet, we form what's called a joint. So looking at the picture here, you cut, let's say you did a coronal cut or a frontal cut, same thing. You go down the bone, you'll see all along the head, which is called the proximal epiphysis, all along the outer rim of the diaphysis is compact bone where it's tightly condensed. Toward the middle, as well as within the cavity, there's areas where it looks like a sponge. So they refer to it as spongy bone. Your bone is very well vascular. You'll see blood vessels penetrate into the bone. It's not like cartilage. Cartilage, however, you don't see blood vessels. You refer to that area as avascular. And at the end of the bone, you also have hyaline cartilage there, as well as in the epiphyseal line if you're still growing in length. And the hyaline cartilage at the end of the bone, epiphysis, because it meets another bone there, they refer to it as articular cartilage. That just means another bone's going to meet there. But yes, it is hyaline cartilage. The cavity within the bone is referred to as medullary cavity, and that's where you find bone marrow, where you produce blood cells, red, white, and platelets. But again, as we get older, you tend to store lipids. Therefore, that's why you see this yellow coloration referring to there's lipids there. Now, the outer connective tissue around cartilage is called the periosteum. Okay. And around the bone, it's the periosteum. Okay. So in the periosteum, you got some cells there that eventually you'll see forming bone. One is called osteoblast. Think of B and blast for bone forming. They're the ones that make the bone hard. And those osteoblasts, once they get trapped within the bone, they form a mature cell. And no longer do you call it osteoblast, you refer to it as an osteocyte. And the little space is trapped within the bone. That space is called a lacuna. Now, because you could store minerals like calcium, phosphorus in bone, you can pull out some of that and release it into your bloodstream when blood levels of calcium, phosphorus are low. So the cells that contain digestive enzymes to do that, they're called osteoclasts. Both the osteoblasts and the osteoclasts came from a stem cell. So stem cells are basically cells that can differentiate into different types of cells. Bone is very well vascular, so you're going to see blood vessels in the bone. There's also nerves going through there and the little holes within the bone, and also lymphatic vessels. What secures this outer periosteum tissue to your bone are connective tissue, and they refer to them as Sharpie fibers. So we look here, we got compact bone, and there you see the outer connective tissue called the periosteum, and the fibers that secure it onto the bone, and they're referred to as Sharpie fibers. And again, bone is very well vascular. You're going to see blood vessels penetrating to the bone. The cavity, again, is referred to as medullary cavity. The inside part of there's a connective tissue lines the cavity. The connective tissue that lines the inner cavity is called endosteum. Endo means within. So periosteums, connective tissue surrounding the bone, and the connective tissue lining the cavity is referred to as endosteum. In both those tissues, that's where, let me jump back. That's where you're going to see osteoblasts and osteoclasts. And then again, when the osteoblasts are within the bone itself, you refer to it as now an osteocyte, a mature cell. All right, when we look at a flat bone, there is no cavity within the flat bone. Basically, in the middle is a spongy bone. Kind of like when I was told as a student, think of a sandwich. You got two sides here, a compact bone, and in the middle, spongy bone. The areas where the spongy bone is kind of like in columns to resist stress, that is referred to as trabeculae. I like to think of trabeculae kind of like the framework of a house as it's being built so that it can resist stress. So here you're looking at the flat bones of the skull. There is bone marrow in the cavities as well as within the spongy bone. And in red bone marrow, that's where you form blood cells. You also have, it says here in the femur, the humerus, there's cavities there with red bone marrow. And some here in newborn infants. The cells that are in bone, remember there's osteoblasts, think of B blasts, those are the ones that form bone. And when they get trapped in the bone, it's an osteocyte. Now it's mature. And then there's osteoclasts, which can digest the bone and release calcium, phosphorus from the bone into your bloodstream when it's needed. Both the osteoblasts and osteoclasts came from a stem cell. And that's what they're referring to here, a fancy name for stem cell, osteogenic cells. Where do we find them? We find them in the outer connective tissue around the bone and also within the cavity in the bone called the endosteum. So here's a drawing of our stem cell, and that stem cell can differentiate into either an osteoblast, bone forming, or an osteoclast. And osteoclasts contain digestive enzymes to release calcium, phosphorus. They refer to it as when calcium phosphorus is put into your bloodstream, that's called bone resorption. I know it sounds kind of backwards, like you would think resorption is into the bone, but no, it's when the osteoclasts break bone down and the resorption is occurring into the bloodstream, where you put calcium phosphorus in the blood. When the osteoblast gets trapped in the matrix of the bone, it's no longer referred to as osteoblast. You can refer to it now as an osteocyte. So picture of our osteocyte, and then to the right here's the bone resorption cell where it contains digestive enzymes to break bone down, release calcium, phosphorus in the blood. It's called an osteoclast. They're bone resorbing cells. Now, the functional unit of any system is the smallest component that does its overall job. So let me give you an example. Like your nervous system, the functional unit, the smallest component would be a nerve cell. For bone, it's a round circular region. They're referred to as osteons. That's how I like to remember them. It's a little easier than saying Haversian system. So those are the functional units of the skeletal system. And if you look here, these little ring patterns, kind of like similar to what you would see if you cut a tree, that's the osteon. And within the ring patterns, you're going to have lamella. Lamellas are these ring structures surrounding or making up the osteon. And within the lamella are fibers, collagen fibers that you find in connective tissue. So here, collagen fibers are to resist twisting forces. And in the middle of each osteon is a canal, an opening called the central canal, where you're going to find blood vessels, nerves going through each osteon within the central canal. And just to take note of this osteon, look at the collagen fibers in each ring pattern, the lamella. For each ring, the collagen fibers are arranged in opposite directions. So that way you can resist twisting forces. So functional unit again of the skeletal system is called an osteon. These are these round circular regions within compact bone. The matrix of the bone that you find making up the rings of the osteon are referred to as lamella, where you got collagen fibers. And then the hole within each osteon, where you find blood vessels and nerves going through, that hole is called the central canal. That's how I like to name it. Or if you want, Haversian canal. Okay, now going down an osteon, the central canal is going straight down. Now these openings go at right angles where you got blood vessels, nerves going through. Those ones that at right angles are called perforating or Volkmann canals. So let's have a look at the picture. So take one of these ring structures, that's our osteon, and the hole in the middle is the central canal. And then the ones that go at right angles, you can see over here in the drawing, those canals are referred to as perforating or Volkmann canals. Take your pick. And then the osteoblast, we mentioned that once it gets trapped in the bone, it's now a mature cell. It's called an osteocyte. And that space that it gets trapped within is referred to as a lacuna. So let me magnify, let me find the slide where I'm looking for this picture here on the bottom left. So here's our osteocyte. It was putting down bone and then it got trapped. And once it's trapped, it's a mature cell now, so you refer to it as osteocyte. Site means cell. The space it's trapped within is the lacuna. You're going to notice that in the central canal, there's also coming off of it these little slit-like openings within the bone called canaliculi. Think of canals. Canaliculi is plural. If you want to say singular, then you call these little narrow slit-like openings canaliculus. So these cells, the osteocytes, are getting their oxygen and nutrients from blood vessels located in the central canal through diffusion. So the osteocyte, once it's trapped in the lacuna, right, it's getting oxygen and nutrients from slit-like openings called canaliculi for plural, or you say canaliculus for singular. Back to our picture here. This is the whole compact bone in the middles of the cavity. The outer connective tissue, again, is called periosteum, secured to the bone through fibers called Sharpie fibers. The functional unit of the bone, these circular rings, they're called osteons. The canal in the middle is called central canal. The openings go at right angles, they're perforating canals or Volkmann canals. And then on the bottom picture here, this is an actual slide of the bone. You may recognize it from the lab on the far bottom right. That's the osteon. And those little dark regions represent the osteocytes within a lacuna. The picture right next to it looks more three-dimensional. More likely that's from an electron microscope. Okay, now recollect that flat bones, there's no cavity, so it's basically spongy bone. And the areas to put down and resist stress, that area of the spongy bone is called trabeculae. So you don't see the ring-like patterns in spongy bone there. They have irregularly arranged lamella, osteocytes, but they also have canals called canaliculi. There are blood vessels there, so it's still vascular. And the smallest vessels providing oxygen and nutrients are capillaries. So here again is our osteon, kind of like they didn't draw it all circular all around. And in the middle is the central canal. The cell trapped in lacuna is now mature. It's called an osteocyte. And the canals, you call them canaliculi for plural or canaliculus for singular. Okay, so the stem cells called osteogenic cells are the ones that can differentiate and make osteoblasts or a osteoclast. And don't forget, the osteoblast becomes mature when it's trapped in the lacuna, and therefore then you refer to it as osteocyte. Just like any other connective tissue, what makes up or you find similar in connective tissue is a non-living component called the matrix. So the matrix consists of anything non-living like proteins, minerals. Here it says proteoglycans, glycoproteins. They call that ground substance. And you may see fibers. So we saw in bone, there's collagen fibers, right, to resist stress. So these two components make up the matrix of bone. And the cells that put down the bone that make it nice and hard are the osteoblasts. And the hard portion of bone is referred to in general as osteoid. What makes bone hard is basically mineral salts that they refer to as hydroxyapatite made by osteoblasts. So 65% are these mineral salts called hydroxyapatite. Mainly it's calcium phosphate crystals. They give bone the hardness and resistance to stress, or in this case, it says also compression. Okay, let's go to the next PowerPoint. Make sure I'm recording. Yes, it looks like I'm recording. And let's bring this magnify. So this is the second part of the PowerPoints. So when you form bone for the very first time, it's referred to as what we got here, osteogenesis. So there's different stages here. It looks like when you develop as an embryo slash fetus, what you first have is hyaline cartilage, and eventually you start replacing that hyaline cartilage and putting down bone. And this begins around the second month of development. After birth, most of the skeletal system's most of it's bone already, but there are areas within the bone where it's still hyaline cartilage. So you'll still grow in length as long as that hyaline cartilage within the bone is still living. And once those cells of hyaline cartilage are dead, you can no longer grow in length. The other thing you're going to be doing after that throughout the rest of your life is just adding to areas where bone is needed or taking out. Depends on the compression and forces you put on your skeletal system. And that is called bone remodeling. So after you're done growing in length, the thing you'll be doing consistently throughout your life is called bone remodeling. Two types of forming bone for the very first time. When you form the flat bones of the skeletal system, like your clavicles, yes, your clavicles is a flat bone, even though you think it'd be long bone. Or the ones of the skull, when you form those for the very first time, it's called intramembranous ossification. Then after that, the majority of other bones, they go through a process by just replacing hyaline cartilage with bone, and that's referred to as endochondral ossification. So let's have a look here. What are we doing for the first time? I believe this one's going to be intramembranous ossification. We're going to be forming a flat bone. Now, if you can remember from the chapter 4, All connective tissues come from an embryonic tissue called mesenchyme. So you have these mesenchyme cells here, and they eventually were going to differentiate into osteoblasts. And it's the osteoblasts, remember, that are putting down bone, making it hard. So once it starts getting hard in this area, it's called an ossification center. Some of the osteoblasts are now trapped within the matrix, the hard part of the bone. No longer is osteoblast, you can refer to now as an osteocyte. Bone is very well vascular. At some point of development, you'll see blood vessels penetrate into the, in this case, spongy bone. And then the cells in the outer region, it will eventually going to form the outer connective tissue called the periosteum. So this is basically what you have at the end of forming a flat bone. Got two sides of compact bone, and the middle is spongy bone. And then the outer connective tissue is the periosteum. And that's where you're going to find osteoblasts and osteoclasts. The actual cells trapped within the hard portion of the bone, well, then you refer to it in those cells as osteocytes. The other type of forming bone for the very first time is called endochondral ossification. Basically, you're just replacing hyaline cartilage cells that are dying, replacing it with bone. So let's take this one step at a time. So at week 9, this stage of development referred to as a fetus, you can see most of the bones is hyaline cartilage. Hyaline cartilage cells start to die, then osteoblasts start replacing there with bone, and where it's hard is referred to as an ossification center. You see the cartilage cells start dying more. They're being limited toward the head regions of the bone called the epiphysis. And in the middle now you start forming the cavity called the medullary cavity. Then you see blood vessels penetrate into the cavity. Bone's very well vascular. You'll start seeing cartilage cells more dying within the heads of the epiphysis, forming what's called a secondary ossification center. And then at birth, this is basically from after birth, from childhood to adolescence is what you have. You're going to have areas of live cartilage cells, if you're still growing in length, located in a plate called the epiphyseal plate, or you could say epiphyseal line. And then at the end of the long bone is also hyaline cartilage. And because there is where it articulates with another bone, they refer to it as articular cartilage. Remember, articulate means to meet another bone in this case. So this is what you have at birth. You'll grow in length as cartilage cells reproduce. And once the cartilage cells are dead in the epiphyseal plate, you'll no longer grow in length. The only thing you'll be doing from then on out is referred to as bone remodeling. Growing in length in general is referred to as interstitial growth. Growing in density or diameter-wise is referred to as appositional growth. What happens as you grow in length? Well, the cartilage cells in the epiphyseal plate will proliferate, which means they'll replicate and increase in number. They'll get larger in size, which is hypertrophy. Then they'll start to harden, which is calcify and die. And eventually then they're replaced by bone, by osteoblasts. And when it's replaced by bone, that's the area where it's hardening. So here, imagine in the drawing top left, there's our epiphyseal plate. In the basal layer of the epiphyseal plate, the cartilage cells are doing mitosis. They're replicating, and they extend out the length on both sides of the epiphyseal plate. They're getting larger, they hypertrophy. And as cells die in the epiphyseal plate, those cartilage cells die. They're being eventually replaced by bone. And what's replacing them with bone are osteoblasts. So as long as cartilage cells are alive in the epiphyseal plate, you could still be developing in length, which is called interstitial growth. What stimulates growth? Oh, well, hormones, right? Thyroid hormone would step up the process of growing in length. Testosterone, estrogen, those hormones also help with growing in length. So you'll see a growth spurt around where you make more of these hormones during a time called puberty. This is a picture when you grow in length. You'll notice that the diameter of these little red lines indicate the length prior to growing. And when you grow in length, you also modify the diameter of the bone. So there's some bone remodeling going on here. So that way you can support the length as you grow. Now, how does your body know where to put bone or take bone from? It's basically on the stress that you put upon the bone. So if you don't, let's say, put so much stress on the bone, you'll take more out. And vice versa, the more stress you put on bone, you'll want to put more there to resist the stress that's being put upon it. Similar to working out your muscles, how do you know where to put more protein so to make the muscle larger? Well, when you work it out more. So that's basically how you know where to put bone down or take out. It does require a diet rich in proteins, vitamins, calcium, phosphorus, magnesium, and manganese. Again, you'll put bone down where it's needed or take out if it's not needed. I don't want to have to read specifically here. It is. You do want to recognize it's the osteoclasts, the ones that contain digestive enzymes. So they have lysosomes that can break the matrix of bone down to release calcium and phosphorus in your blood when it's needed. So these cells are responsible for what's called bone resorption, not putting into the bone, but doing the resorption by putting into your bloodstream, putting in calcium and phosphorus. So here, as these cells break the matrix down to bone, the calcium phosphorus will travel across the cells and eventually enter the fluid called interstitial fluid, which is found between your blood vessels and tissues, and then eventually it will enter your bloodstream. What else controls where you want to put bone or make more of? Here they're referring to how do you know when to take calcium out or to put calcium into the bone? Okay. Not necessarily where to put bone down or take out through hormones. Okay. And the forces again, how do you know to put more bone down or take out the stress you put upon it? So there's two hormones that help maintain constant calcium levels in your bloodstream. One's called parathyroid hormone, and the other one's called calcitonin. Why do you even need calcium? Well, calcium's needed for neurons, which is a nerve cell, to communicate to targets. So in other words, in order to release neurotransmitters, you need calcium. Neurotransmitters are the chemicals used by neurons to communicate to targets. You also need calciums for your skeletal muscle, cardiac muscle, even smooth muscle to contract. You need calcium to form a blood clot should you have a slight tear in a vessel. You need calcium for glands to release their products. We already mentioned nerve cells. You need it to release neurotransmitters. Looks like you need calcium also to promote cell division. So going back to which hormones help maintain constant calcium levels in the bloodstream. One is called parathyroid hormone. In your thyroid gland, let's see, they have a picture here. Yes, they do. So in the neck region, your cervical region, the neck, there is a thyroid gland. You're probably familiar with thyroid hormone that it'll increase your metabolism. That is one hormone. But if you turn your thyroid gland around, you'll see little pea-sized glands embedded within it. Those are called parathyroid glands. So should calcium levels fall below normal in the bloodstream, these parathyroid glands will release the hormone called parathyroid hormone that will travel eventually to your skeletal system and cause osteoclasts to start breaking bone down to release calcium into your bloodstream to bring calcium levels back to normal. So again, let's say blood calcium levels drop. That stimulates parathyroid glands to make parathyroid hormone. Parathyroid hormone stimulates osteoclasts to break the matrix of bone down, release calcium in the bloodstream, returning them back to normal. Parathyroid hormone, another target, is promotes the synthesis of vitamin D at the kidneys. You need vitamin D in order to absorb calcium. Therefore, the more vitamin D available, the more you'll absorb more calcium from your diet. All right, now what if you took calcium supplements and now it's high in the bloodstream? Now you want to promote and take the calcium and put it into your bone. So after you, let's say you took supplements, the calcium levels in the bloodstream are high. There's other cells in your thyroid gland called parafollicular cells. They make a hormone that does the opposite of parathyroid hormone. So these parafollicular cells make calcitonin. Calcitonin, once released in your bloodstream, travels to your skeletal system and stimulates osteoblasts. Osteoblasts will uptake the calcium from your bloodstream and put it into your bone. So let's just quick review. When calcium levels fall below normal, parathyroid glands make parathyroid hormone, stimulating osteoclasts to do bone resorption, break down the bone, release the calcium and phosphorus in your blood. That's where the resorption is occurring. Vice versa, calcium levels are high in the blood. That stimulates the release of calcitonin, which stimulates osteoblasts to take up the calcium stored in your bone. We're not going to focus down here on this hormone called leptin. Looks like this is a different hormone that influences your bone's density, in other words, the thickness, by inhibiting osteoblasts. So if you inhibit osteoblasts, well, you're not going to make it so dense. It'll be less dense. All right. Back in the day, if someone discovered something, they got to name it. I'm sure that still applies. Wolff's Law, I think it's just common logic. Let's say the more you use a bone, the more stress you put upon it. That's where you want to add more bone. So it's going to be denser. So let's say if you're right-handed, use your right hand more, the bones within the right hand are going to be a lot more dense compared to the bones in the left hand. So that's all that it means, Wolff's Law. The more stress you put on the bone, the denser the bone will be to resist the stress. Bones where they curve, you don't want them to buckle. You're going to see more bone being put down in that area to resist buckling. Spongy bone, where there's more stress, you're going to put more spongy bone in columns to resist the stress. So that area where you're resisting stress in the spongy bone is called trabeculae. When you work out your muscles, your skeletal muscle, they're attached to your bone. So the more you work out a muscle, you don't want it to disattach from your bone. The bone's going to form a more prominent region to attach to the tendon, so that way the muscle doesn't disattach. So large bony projections will occur where heavy active muscles attach. Bone is uniquely designed where you put stress upon it, it can, because it's arranged in a certain way, can produce a counter stress. So you're looking at a picture of your femur, which is in the upper part of the leg. You put most of your body's weight, right, on the femur's head. And the way, because of the bone is made, it produces a counter force to resist the stress. Can you overwhelm its ability? Yeah, sure. Keep putting more weight. But the main idea is because of the unique way bone is made, it's to resist stress. Okay, no one likes to break anything. When you break a bone, it's called a fracture. Sometimes when you fracture a bone, the bone may come out of its normal alignment. If so, they refer to that as displace. If the bone fracture does not come into alignment, then it's referred to as non-displace. Sometimes you may have a fracture and it doesn't go all the way through or across the bone, then it's referred to as incomplete. If the break occurs all through or all across the bone, then it's complete. How did the fracture occur? Did it go across? Well, then it's transverse. If it went straight down, up and down, it's referred to as linear. The ones I don't like to visualize, I don't like to see anything fracture, especially in sports, but I don't want to visualize any bone penetrating the skin. If it does, they refer to that as open or compound. Whereas if the bone fractures, it does not penetrate the skin, you refer to it as simple or close. Fractures can also be described in the location of the fracture, the appearance of the fracture, or what caused the fracture. So here you're looking at a commutative fracture where the bone breaks in several pieces. Fortunately, as we get older, you take more bone out than you put in, and therefore becomes more brittle. And areas where there's stress as you get older, it may fracture in more than one piece. Therefore, it's referred to as commutative fracture, where it fragments into 3 or more pieces. Commonly happens as we get older. Compression, just like it sounds, what caused the fracture, physical compression. So this occurs where most compression in the body happens in your vertebrae. Spiral. Well, this one's common in sports where you may see someone try to change their position quickly and change directions or attempt to, and the bone can't take that resistance and it fractures in a spiral way. So that's a spiral fracture. Epiphyseal, well, at some point in time when we're growing in length still, those cells in the epiphyseal plate are going to die. And that's it. You're done growing in length. Sometimes, should you have a separation here at the epiphyseal plate, well, then it's called an epiphyseal fracture. Tends to occur where cartilage cells are dying and hardening of this area is occurring. Depressed fracture, what caused it, and it was physically pushed upon. So that's what they mean by depressed fracture. A green stick, similar to like trying to break a green stick, won't break all the way through. So when we're young, our bones aren't fully hardened. They're somewhat still pliable. So if a fracture occurs, it may not completely go all the way through. Therefore, it's referred to as green stick, where the bone's still somewhat pliable. Here it says bone breaks incompletely, much in the way a green stick or twig breaks. Only one side of the shaft breaks, the other side bends. Common in children whose bones have relatively more organic matrix, and they're more flexible than those of adults. You'll notice kids take falls in here and they're okay, versus an adult, we're not as flexible, it's hardened, they're more likely to break bones. When you fracture a bone, you probably torn vessels within the bone, causing bleeding. So here, hematoma forms, basically blood clotting. You have the vessel bleeding, so hemorrhaging is referring to the bleeding. You want to form a clot, so you want to form what's called a hematoma. Because vessels are leaking fluid, the site becomes swollen, and as pressure builds, it will interpret it as painful, and it's inflamed, it's warm because more blood flow is going to the area. So here you have a fracture, blood vessels are torn, you're bleeding, you eventually want to form a hematoma, this blood clot. Then you want to start repair. So you want to start putting down, replacing the collagen fibers. So you form what's called a fibrocartilaginous callus. White blood cells, yes, they'll come to the area. They're phagocytic, will phagocytize dead tissue. Hopefully, they get rid of anything foreign, should something foreign be there. And then osteoblasts start putting down spongy bone. And now we're going to connect the separated ends with collagen fibers. So fibroblasts make collagen fibers to connect both ends. Now it says the massive repair tissue is now called a fibrocartilaginous callus. So picture here of our fibrocartilaginous callus. The next thing you want to do now is make it a little more rigid, harder. So nutrabiculae form a bony or hard callus. This continues until the union is formed in approximately 2 months. You connect the ends. It approximately takes 2 months. So now it's nice and hard. The only thing here, it doesn't quite look like what we had before. So the last thing we want to do is remodel it so it looks similar to what you had before. And that's called bone remodeling. And it's going to respond to the stress you put on the bone until finally it resembles to what you originally had prior to the injury. So there's the bone remodeling. Now, yes, bone can repair. Unfortunately, as we get older, it takes longer. This is just what we went through. Some imbalances or diseases of the skeletal system. One is osteomalacia and rickets. Basically, you're not putting calcium down enough where it's needed. And because the bone is not as rigid as it should be, may bow out where stress occurs. So if this is the case and it happens in children, they refer to it as rickets. Causes bowed out areas like in the bones of the leg and other, it says bone deformities. What's the cause? Well, you need what in order to absorb calcium? Vitamin D. Either you're deficient in the vitamin D or you're not getting enough from, let's say, your diet as well. Unfortunately, as we get older, instead of putting more bone into our skeletal system, making it nice and dense, we tend to take more out. And as you take more out, instead of looking nice and compact, it looks more like a sponge. Therefore, it takes on the appearance of spongy bone. Basically, bone resorption, which means taking out, is outpacing bone deposit as we get older. And the areas of the bone where you took more out now it looks like a sponge. Now it's more susceptible to fracturing or breaking. Risk factors. Estrogen, ladies. So estrogen does help to absorb calcium, or even maybe a lack of calcium in the diet or an inefficiency to absorb it because you're not getting enough vitamin D. Petite body form, immobility. Basically, if you don't use and put some little stress on your bones, you'll take more out. So there is some point where you do want to do moderate exercise so that you could tell your body, hey, we need to put more bone down here, and yet not totally just relax where you're going to be able just to take it out. So moderate exercise will help put bone down where it's needed. Fortunately, as we get older, we make less thyroid hormone. So low amounts of thyroid stimulating hormone will also decrease the density of our bones. And diabetes. In diabetes, there's excess amounts of sugar in the bloodstream may cause damage to capillaries. Capillaries are providing oxygen nutrients to tissues. If you can't provide oxygen nutrients to tissues, tissue dies. Okay. So up top is an area where the bone, areas where, yeah, it kind of looks like a sponge, but look at the density of the bone versus the bottom. You could see you're taking more out as you age, and it looks more like spongy bone. It's not as dense. So how do we keep osteoporosis at bay? Well, supplements like calcium, vitamin D. I'm not sure about the fluoride in the water. I wouldn't go so much with that. At some point, it may be damaging. Take too much fluoride. Moderate exercise, we already mentioned that. You want to tell your nervous system or you need to put bone where it's needed by moderate exercise. Hormone replacement, I guess some point in time, ladies, you're all going to go through menopause. So estrogen replacement therapy would help to slow down bone loss. Some drugs that I'm unaware of here will help increase bone mineral density as well. Paget's disease is excessive haphazard bone formation and breakdown, usually occurs where most compression occurs, like in the vertebrae. That protects your spinal cord, your pelvic region, femur, or skull. So basically, it's always a balance of how much compact and spongy bone you have to be normal. Now, when you start putting more spongy bone down than compact bone, that's not good. So that leads to here Paget's disease. What can cause that? It says what? Unknown, possibly viral. Treatment includes supplements like calcitonin and biphosphonates. As you develop, when developing as an embryo, you'll start replacing cartilage, hyaline cartilage with bone. So at certain stages, if you took it says here an X-ray or sonogram, you can also determine the age of the development due to the hardening of the bone at what stage you're at. And at birth, pretty much they resemble adults. It says here at birth, most long bones are well ossified, which means hardened, except at the epiphyseal plate, where there's live cartilage cells so that you can grow in length. Once the cartilage cells in the epiphyseal plate are dead, you can no longer grow in length. The next thing you'll do throughout your life is referred to as bone remodeling. You're adding to or taking out. Here you're looking at probably an infant, or somewhere between newborn and infant. You're going to notice they may have these soft spots on the skull called fontanelles that keep the skull somewhat pliable. So that way at birth, they can get through mom's birth canal. The other thing they do, they allow some growth. And then after a year, the soft spots of the skull called fontanelles will harden into what's called sutures. Okay, I believe this is the end of the chapter. Oh, no, not quite. Let's finish it out. Nearly all bones completely ossified by your 20s. Unfortunately, as we get older, the density decreases. Also, your environment may have an effect on your skeletal system as well. Your genetics as well, to keep it at bay, may also play a role. But again, in old age, we're all going to go through some form of osteoporosis where taking out, called resorption, is outpacing bone deposit. Okay, now it's done. I'll stop share and I'll see you next time where we'll do the next chapter.